prevent damage to the joints by taking a few small steps over the next few years. Welcome to Dr. Ashori. I'm a family medicine physician turned health coach. And one of the most important topics to me is the ability for us to engage in the activities that we love. I'm a rock climber. I love rock climbing, specifically bouldering, which is quite intense on your joints. You're high up, you're going to fall off a V7 or V8, and you're going to land in the most awkward ways. I'm always going to do some minor damage to my joints. My question is, how can I prevent excess damage? How can I make sure my joints recover? How can I determine if I'm at risk for developing something in the future? And of course, prevent that from happening. If you are engaging any kind of activities, especially repetitive, such as swimming, using your shoulders quite a lot, tennis, where it can be a little bit tough on your knees, basketball, which can be quite tough on your back and your ankles, and rock climbing, which is brutal on your hands and probably the rest of your body, the most important thing for you to determine is what are your risk injuries, your injury risks. For most of us, it's going to be that particular joint that we put the most amount of strain on. And a pain that you develop, especially after your activity, is a great sign. If that pain happens around the time that you're doing the activity and generally resolves once you rest it, it means your body is able to cope with that pain. It's unlikely for that kind of discomfort to lead to any long-term damage. But if you develop a lot of inflammation, joint swelling, and then pain that lasts for several days after one exercise episode or one activity, it's more likely that you're causing chronic inflammation in that joint that may lead to damage to the synovial sac, to the lining of the joint capsule, and that can all kind of deteriorate your joints. Besides sensing your pain and the duration of pain, the other thing is how flexible you are in the joint. So for example, when I do a heel hook in rock climbing, for those of you who know, I've noticed that my hip is just not as flexible. It's probably better for me to focus a little bit more, put a little bit more time and effort into improving my hip external rotation and being able to improve my knee stability, which affects my hip stability, than it would be for me to continue trying to master some V8 or V9 problem. So those mobility exercises, they don't have to be long. Both before your exercise and after your exercise can be very good at preventing further damage. One example I always like to tell patients is imagine you've had an ACL tear, very common in us athletes, or even a clavicle fracture like I have here on the left. Both of these injuries are going to change the dynamic, the biodynamics of your joint. And so they're going to now create friction and hot spots in different areas than you would normally. If you continue exercising in that same way and don't rebuild the muscles around that joint after that injury, your chances are you're going to develop problems down the road. And of course, as you know, if the shoulder hurts, your neck's going to hurt, and then your elbow's going to hurt. If your knee hurts, your back's going to hurt, and your ankle's going to hurt. They're all interrelated. So after any injury, what's helpful, or any surgery, is to then strengthen that joint and build mobility and stability around that joint so that you can help prevent future injuries, future inflammation, and decrease your risk of osteoarthritis. Finally, the third thing I'll mention is the family history you have of arthritis. Now, I look at my dad's hands. He's always had a very physical job. He's got gnarly arthritis all around. And I asked him, hey, that must be pretty painful. He's like, what? I'm like, those giant things on your knuckles. He's like, what giant things on my knuckles? They look normal to me. And I'm like, what about the pain? He's like, I have no pain. So as always, it goes to show you that pain and physical findings are just so objective, or I should say subjective. And objectively, you might see something on an x-ray, but the patient might say, I got no pain. But he does have obvious arthritis in those joints. So now that I know that if that arthritis develops, it's really important for me to have really good range of motion, flexibility of my joints in order to prevent that in the future. Of course, it's not just flexibility, mobility, and strength of a joint. It's also the inflammation in our body. And of course, that has a lot to do with what we eat, the stress level, how we sleep, the kind of things we put in our body, nutrients, and even medications. If you find such content helpful, please share your comments below, subscribe, and thanks for listening.